Tara Stamps. I work for the Chicago Teachers Union, and I'm a 25-year veteran teacher. And I want the panel, well, before we do that part, I want to say thank you to Carmen. She's waving at us. She's the executive director of the Chicago Teachers Union Foundation. I want to say thank you to the American Red Cross. I want to say thank you to Nina Hike. She was very, very passionate about making sure we brought this into fruition. I want to say thank you to members of the Pan-Held Council, so they'll also called the Divine Nine. So they came on board as our partners, and of course, the Chicago Teachers Union. And I don't think I'm missing anyone, but if I am, Carmen, call me on it. Okay. So please do take a seat, grab some snacks, donate blood, and learn something. Okay. So what I'm going to do is just from my left, I think y'all right, and we're just going to come on around. I think there's a mic there for everyone. Fantastic. This doesn't always happen. So I'm just letting you know the fact that you got your own mic. We are special up in here. So if we could just come around and a couple things, just tell us who you are and what brings you to this space and what capacity are you representing in this space today?
My name is Carmen Perry. I oversee the sickle cell drives for the state of Illinois for the Red Cross.
I am Terrell Burgess, principal of George Westinghouse College Prep High School, right here on the west side of Chicago. Former executive board member here at CTU, so I feel like I'm back at home, but I have a 15-year-old diagnosed with sickle cell disease.
TaLana Hughes. I am the executive director for the Sickle Cell Disease Association of Illinois, and I have a 20-year-old daughter that has sickle cell disease.
My name is Robert Liem. I'm a pediatric hematologist at Lurie Children's Hospital. I also direct the sickle cell program there.
Wow, thank you so much. There's sure to be so much information that you guys are going to share. So we're going to just dive right in because I had some questions specifically for the doctor. And I wanted you, if you could, just explain to our audience, what is sickle cell disease? Like, what is actually happening in the body?
First of all, thank you very much for the opportunity to talk about sickle cell disease here. It's a very, very important topic to talk about, and I really appreciate everybody who's donating blood on behalf of sickle cell disease today. The easiest way to explain sickle cell disease is that it is one of the most common inherited blood disorders out there that primarily affects people of African Americans or African descent or Afro-Caribbean descent. It's a genetic condition whereby you're not making the right kind of hemoglobin, which is the part of your red blood cell that helps to carry around oxygen. And as a result of inherited traits that you get, you make, instead of making normal red blood cells that are kind of these donut-shaped red cells that are able to flex and bend through your blood vessels, you make what's called sickle cells, or these sickled or C-shaped red blood cells. They tend to be really rigid, and because of that, they don't squeeze through blood vessels very well. They block the blood vessels, depriving organs of oxygen and blood, and can cause a whole host of different complications. The red blood cells in patients with sickle cell disease also don't live as long. So normal red blood cells last about 120 days once your body starts to make them. But in sickle cell disease, they only really live about 20 to 40 days. And that's where you get the anemia part of it. You have low blood counts because these sickle red blood cells don't live as long. Some of the complications that we see in patients with sickle cell disease can vary from patient to patient, but oftentimes, can involve really debilitating pain episodes. They can cause, the disease can cause acute organ injury as well as really chronic organ injury as well. So acute lung injury, stroke, heart problems, kidney problems later on can be a really devastating medical condition, unfortunately.
So a whole host of things are impacted by the blood, or the blood not getting the right amount of oxygen. Why is it so painful? From what I understand, it's really, really painful. And both parents talked about the pain crises. What is happening in the body that's causing the pain?
Yeah, so the acute pain episodes or pain crises are really the classic symptom of sickle cell disease. And so the way I describe it to parents is that, you need blood and oxygen to get everywhere in your body. And, where you block off the blood and oxygen is where you get organ dysfunction. One of the areas where you can have a lot of pain is in your bones. So if you think about it, it's like having a stroke in your bones, whereby you just can't get enough blood and oxygen to the bones, which then causes a lot of that pain that these patients are having. There are a lot of nerves on the surface of the bones, as well as other parts of your body. And so, patients with sickle cell, when they have these acute painful episodes, they can last anywhere from 3 days to a week to 14 days. And over time, they can develop what's called chronic pain syndrome, so that, every time they have a painful episode or a pain crisis, it kind of builds on itself and can lead to chronic debilitating pain that they can experience almost every day.
My God. Mr. Burgess, I know that you said your son's 15 now, and
Sunday.
15 Sunday, and I know that this has really impacted your family. Can you tell us about, like, that's the science of it. What does it look like in real life?
In real life, it's just a complete nightmare, to be very transparent. But one of the things, everything that Dr. Liem, who happens to be one of my son's doctors, so we are blessed and fortunate to have some of the best and brightest in our city caring for our child. That's why healthcare is so important, but that's a whole nother conversation
No, we're gonna
for
hit that a
another
little
day.
bit too.
But as a parent living this out with my son, I just left him, and he's a student at what he was in pain today. He was in yesterday. He's dealing with pain on a consistent basis, and not only is it affected physically, but affect him emotionally. And so, with an angry child, I mean, look, can I borrow your mic? I'm sorry.
Yeah,
Need
yours a
I need
little
mic that-
temperamental. Look.
I know how to work a mic. I just need one that works.
All right, all right.
But so we're dealing with the debilitating physical part of the disease. But when it begins to affect them mentally and emotionally, when they realize that their quality of life is limited, then you have to deal with all of the emotional setbacks as well. He loves baseball. He's a great athlete, but he can't play as much as he would like because the crises prevent him from it. And I've even had other parents with sickle cell say, "Why do you want to let him play anyway?" And I just want him to have a normal life. So if he wants to play baseball, I want him to be healthy enough to do so. But right now, he's not in a position to do that. And just the backlash, it's just painful to watch your child suffer on a consistent basis. Even with all of the research and the new medicines that are available, we're still navigating that course too, because you have a 15-year-old, but you still got to watch him like he's 3. It's like, I need to actually see you take this pill every day. And now we're actually going through that process. Like, if I'm not at home, videotape me now. Let's FaceTime, because I need to make sure that you're doing what you're supposed to do so that you can maximize the quality of your life.
Wow. So I want to hear about your 20-year-old, and also I know from our conversation that both parents have to have the trait, right? For your child to be born with it. But I want to also get back to some of the numbers around that. But can you tell us about the pain management, and how does that medication impact the child or impact the person? Well, the doctor can, and I want to see the lived experience of what that's like.
Sure. I just wanted to go back to Terrell's comment about sort of quality of life. People forget that if you have a chronic medical condition, your quality of life will deteriorate as you get older, and especially if we don't address the medical aspects of that condition. And just to give you an idea of the kind of quality of life that we see in children with sickle cell disease, a colleague of mine had done a lot of work evaluating specifically the quality of life of children with sickle cell disease. And this was a study that was published years ago, and I still show these results to the second-year medical students every year when I give them their lecture on sickle cell disease. When you look at validated tools to measure quality of life, children with sickle cell disease will report certain measures like physical functioning at a level as low as that reported by children with cancer on treatment. So that just gives you an idea of how to compare the quality of life of children suffering from sickle cell disease compared to other medical conditions. You know, I've been doing this for a long time, and I wish I can say that we've had a huge pipeline of new treatments for sickle cell disease, but it's really only been in the last, I'd say 5 to 7 years, maybe 10 years, where we have had newer options. You know, the mainstay of treatment for sickle cell disease is to try to treat the pain with pain medications. And that can be good on one hand, but it can also be problematic because we're dealing with pain medications that's, you know, that are strong, like opioid analgesics.
Oh my.
And so when you're talking about opioids, some people call them narcotics, that it brings to, you know, to light just a whole level of complexity in managing opioids in children as young as toddlers who are on them. You know, we could talk a little bit more about the role of transfusions later on, but
Sure.
you can see how, you know, all of these treatments, you know, we can offer to patients with sickle cell disease, and yet, you know, the management day to day of these, you know, pain episodes can be really, really complicated and can affect all aspects of their lives.
TaLana, I saw as he was talking, you were just kind of like shaking your head. I don't know if he was kind of playing it all back of what it was like to watch your child go through these crises. Can you share a little bit about that and the medication part? Because I can only imagine what that must feel like as a parent if when you are administering these heavy medications to your child.
Yeah, so I was processing while he was talking. So even before addressing that, it's Black History Month.
Sure.
And so historically, just African Americans and our health is with there's the treatments that are now is taking a long time to get to this point. So what we see just from a community standpoint is you have a group of people that feel hopeless because you figure after a few decades, we still only have 5 treatment options. So prior to those,
what are those treatment options, if you don't mind, if I could just stop you right there?
So first, before those came around, it was blood transfusions and pain medicine.
Okay.
So we know those are only putting Band-Aids on a situation and really are causing long-term damage. So currently right now they have hydroxyurea. That's one of the treatments. They have Oxbryta, and those are pills that you take. They have Indari, that's like a fancy L-glutamine, but that's kind of more of a natural medication. And then we have Adakveo, and that's like an infusion that patients would go in monthly or however so often and get infused, and that would potentially help to decrease their pain crisis. But I'm saying that to say when you have a population that for so long didn't have options. So now you have all these treatments, so you still have a population that's kind of not trustworthy of even these newer treatments. Because I mean, historically, and even when it comes to donating blood and Tuskegee Airmen and Henrietta Lacks, I mean, historically, we weren't always treated fairly. So there's hesitancy in families wanting to even be a part of these new treatments, or some that feel like, okay, I have sickle cell disease, but you know, I'm just gonna deal with it as it comes and not take a chance on something that potentially could treat them better, or almost even there's curative options now too. So it's almost like starting over for a disease that's been around for over 100 years, and they still use, we still don't have correct data because there is no registry. So the estimate of 100,000 people having sickle cell disease in the US has been the same I've been at the organization for 20 years. So that's the same numbers that we're using, but people are still being born. And in the state of Illinois, we testing for sickle cell disease and sickle cell trait was added in 1989. So I was born in 1979, so I wasn't tested at birth. So anyone born prior to 1989 was not tested at birth. So we still have people walking around that don't know they're carriers of the trait. We do screenings from the community-based organization, and we still even find people that have sickle cell disease and didn't know they had sickle cell disease. So I mean, there's a lot of history that is kind of some of the rationale to the why we're at where we are with sickle cell disease today, which really should be way further along. Like we shouldn't be the lowest on the totem pole when it comes to funding and treatment options, when from the newborn screening standpoint, we have the highest, the sickle cell trait and sickle cell disease is the highest test results that you get from genetics. When
Yeah,
babies
it's
are
funded.
tested.
What,
Yeah.
but tell me about the funding a little bit.
It's not, it's a
It's-
little bit.
It's a little, it's a little bit. Yeah. She mentioned Henrietta Lacks, right? And we saw the movie and we know what her contribution has been to science. Why, can you just shed a little light from your perspective about why Black people in particular are still so apprehensive, when it comes to doctors, period, but certainly when it comes to medicine, medical testing, donating blood and things of that sort?
I think like TaLana said, it's just historical, because historically people of color have not been treated fairly. And I mean, they've been fooled and they've been lied to. And so what I find going out to different blood drives, in particular the sickle cell blood drives, I'll ask, is this your first time donating blood? And if they say yes, why is this your first time? And these may be older people. And they said, we just don't trust it. We don't know where our blood is going. We don't know what's being done with our blood. And then I've asked people, well, are you interested in donating blood? And their first response is, again, I don't know what's going on, so I'm not giving my blood to anybody. I don't trust the medical community with my blood. And so it is disheartening. And then you listen to the stories of the parents, and I've met many, many other people who are experiencing sickle cell disease. And these are adults and children. And it's unfortunate because those are the people who benefit from the blood transfusions. And so with the Red Cross, they've put this Sickle Cell Initiative in place to inspire and to educate and to get more individuals of color to donate blood. But again, as everyone has mentioned here, I mean, it's a temporary solution. And then you still have so many drawbacks and so many hangups within the community. They're just not trusting. They're not trusting of what's being done. What they're being told versus what's being done, it just doesn't line up for them.
And it makes
So-
sense. I mean, their apprehension, their fear, it makes sense, right?
Can I just say that, while there's apprehension in giving blood, there's also a lot of apprehension in receiving blood. So, oftentimes a barrier for me is the first time one of my patients needs a blood transfusion for a complication, because sometimes, with the pain episodes, your blood counts drop, or you could have other complications where you become really anemic and you need a transfusion in the hospital setting, or sometimes you can be at risk for these chronic complications like stroke, for which you need monthly blood transfusions. And the first time I talk to somebody who's never had a blood transfusion, either a parent or their child or an adult, it's always looking at me like, well, how safe is that blood? Where does that blood come from?
I know.
How is it tested? So it's even scarier for them on the receiving end.
I can only imagine, but I want to go back a little bit. I skipped a question that I think is, why is it so prevalent in people of African descent?
Can I answer that?
Please.
As the disease or
Yes,
the blood
disease,
side?
the disease.
Trait is really
So,
common.
right. So, but one thing I want to kind of remove the stigma of just African American, because sickle cell does not only affect African Americans, it's genetic. So we got to kind of begin to look at sickle cell as genetics, because anyone can have kids together. So it's not just African Americans that have sickle cell disease. It's just the majority in the United States. And I don't have like all the data, but I know it's
But I think
worldwide.
I
African
think
Americans.
the point that you make is significant.
Yeah.
Because I think when we begin to classify something as though it only impacts our community, which we know historically in all situations are the least, the last, and the left out, and we do not broaden that conversation to say, no, this is a genetic disease that impacts all kinds of people, and thus it needs the same kind of funding other diseases receive. So I understand where you're coming from with
There's
that.
Hispanic individuals, Caucasian, Middle Eastern, Indian, Italian. And what I found from some of those patients, they get reverse racism, I would say. So then when they go to the emergency room and they're there telling the people that they have sickle cell disease, they say there's no way possible that you can have sickle cell disease. But it's because they don't understand, they're not looking at sickle cell disease as being a genetic condition. It's a black disease.
Condition.
And
It's a
that is
black
represented
condition.
in the lack of funding and the stigma and the racism that a lot of our patients and families still experience today.
And so the re-education process part is huge. It's a huge mountain to climb with just re-educating the general public to change the conversation and the narrative about what it is. Doctor?
I was just going to say that, you know, the most common form of sickle cell disease results from inheriting 2 copies of the sickle cell trait. And just like TaLana said, the sickle cell trait itself is really found all over the world. And, you know, while we understand fairly well the numbers that are seen in, you know, Central Western Africa, it's also very prevalent in the Middle East. It's very prevalent in India. There are millions of children, we believe, in India who have sickle cell disease who just aren't diagnosed. But it's just, it sort of reflects sort of the pattern of the individuals in the US who have sickle cell disease that we primarily see those of African descent or Afro-Caribbean descent. So if you go to the East Coast, their sickle cell programs look very different because you'll find
The population.
exactly of the population. And in New York, for instance, my colleagues in those hospitals take care of many individuals who come from Honduras or Ecuador or, you know, Puerto Rico who have sickle cell disease.
How is the disease different from the trait?
Yeah, so when we talk about genetic traits, it's really just usually the easiest way to think about it is you have 1 copy of a trait that may only be problematic if you have a child who inherits 2 copies of that trait. And when you have sickle cell trait, it gets a little bit complicated because I think for many, many years we thought that just having sickle cell trait wasn't associated with any health issues. That's been dispelled. And I think through large epidemiological studies, we're starting to learn that even adults who have sickle cell trait can be at higher risk for certain health problems, like sometimes a higher risk of blood clots, or women who carry sickle cell trait may be at higher risk for pregnancy-related complications, hypertension or kidney disease. So I think we're just learning a little bit more about that. I think, you know, for those of you guys who follow, you know, NCAA, there was a lot of controversy years ago when they thought that athletes, elite athletes who really exercise or exerted themselves at a very high level, that if they had sickle cell trait, that put them at risk for sudden death. The science behind that is still really, really fuzzy, but that was probably, I think, TaLana, would you say was the most media coverage of sickle cell trait was in 2014, maybe, when
That's fairly recent. I
NCAA
mean,
had
that's been like 7
mandated that every student athlete,
Yeah.
first, you know, D1, then it went to all divisions, required testing for sickle cell
And
trait.
interesting, it didn't really get the attention that it was due, and more is due until it became athletes.
Exactly.
And then
Because, you
even,
know, America got to be entertained.
and even with that, a lot of people approach that more as discriminatory. So now it was like they don't want to be discriminated against because they have sickle cell trait, but health-wise, there's so much information that there's just haven't been enough research done on people that have sickle cell trait to really know if, you know, we know that overexertion, if you travel in high altitudes, that a portion of my red blood cells sickle at times, because when you're a carrier of the trait, then some of your red blood cells can sickle, but just not typically to the extreme of an individual that
Thank
has
you for
sickle
saying
cell
that, because
disease.
that's what I wanted to hear. How was that trait? Like, how does the trait presents itself differently than the disease itself? But I want to come back over here and ask you, because I guess I'm just thinking about, as an educator, the impact it has on your child's education, what that means for his play life, what that means for his social life, what that could mean for how he handles the mental, emotional. We talk about social emotional, right? So whatever that mental, emotional, and social emotional impact that you see in your child.
Well, one of what, you know, I'll answer a different question before I get there, but one of the ways I like cope is like sometimes just telling inappropriate jokes. And so, you know, as a principal, part of my sustainability as a principal as metrics at school. So like I'm always involved with grades and I'm always involved with like attendance rates. Our attendance rates would need to be high. But my son alone is tanking my attendance rates at my school just so terribly that I'm just like, look, I mean,
Can I disenroll you and just
yeah,
homeschool you and get you
I
off?
was like, bro, I'm about to send you to the virtual academy. You're bringing my numbers down. But yeah, I mean, he his attendance is impacted, right?
But would he not, like, just stop there for a minute? Wouldn't he be a candidate for the virtual academy?
I mean, he can be, but my son said this to me, and these are the things that you have to listen to your children.
Sure.
He said, Dad, if you put me in the virtual academy, I would just die.
Oh,
Like, I mean, and you have to listen, like, to your child. So, like, as much as
I know how
it
that
could
just hit
frustrate.
me. I can't
I mean,
imagine how it hit you and your
the
wife.
fact that I'm trying to keep my composure because I got extra brothers in the room, so I gotta remain strong. But I'm talking about like the level of tears that you cry because when you see your child suffer. Like, I mean, of course, I think as an educator, virtual academy is the way, but we live through remote learning, right? We lived through the pandemic, barely. And I saw my child then suffer. We were like, well, we're at home, you should be able to get through this. Some of his worst moments in his life were during the pandemic when we were all at home together. And, he even suffered more. My child thrives over human interactions from his peers. He could care less about adults. We're just there to provide us. We're just there to provide a service. So he wants to be around other students. And so, like, even at school, sometimes, like I put in place, if he's calling for a nurse, bring a wheelchair. He's embarrassed by the fact that he would have to use a wheelchair to get from one place to the next. And we have to understand that. On one end, I'm like, I would love for somebody to come and push me around the school. But, like here it is, they're suffering from the just the impact of like trying to please their peers. Peer pressure is real, and it's even escalated with children suffering from chronic illnesses. They don't want to be seen as different. They don't want to be seen as needy, and so like that. I mean, it's dramatic, and people need to know it. So a lot of times I'll come to work and people like, you just look exhausted. Like this work is not like the school itself is not tiring me out some days. But like living with a kid with a chronic illness, like of course I'm tired. Like stop asking me why you look tired. Like I should just wear a sign. I'm tired because but I mean the reality of it is a lot to navigate on a consistent basis. And Dr. Liem can speak to this. There are times I have to advocate and say, look, I can't take off today and bring them to the doctor. Like we've been at the hospital for 2 weeks now, and I've taken off 3 or 4 days. Like I burn my sick days because of this, right? Like we are using our benefit
using
time.
a union.
I mean, but I thank God for the little bit that I do have.
Right.
Because CTU, y'all got some power. So stay strong. Stay strong.
Say it for the people in the back.
Those benefit days I'm experiencing is because you continue to fight. So fight on. But the reality of it is we are using our benefit time.
Yeah.
We are, and we're not even using it for ourselves. We're using it to take care of a child.
So let's stop there for a minute because I want to talk a little bit about, because inside the benefit days is basically like your insurance package, right? Your benefit package, what you are due on your job. So you just said because you came out of CTU and you still had some benefit days and some time you a middle-class employee. What does this look like when you don't have that salary? When that's not the insurance, when you don't have the benefit days, when you're not in a 2-parent household, like what is the quality of life, not only for the child, but for the family?
I don't want to monopolize this, but I will say this. I can't imagine doing this as a single parent, male or female, right? My wife and I have been united in this front day one. And even when you think it's going to rip your family apart, we recognize all we have is each other. Can you imagine? But there are many families that are in the struggle alone. And our extended families don't understand. Like if you were to ask parents and siblings and cousins, them and all of them, like they don't fully understand They just think, okay, you're going to grow out of it one day. People keep asking me, you're going to grow out of that, right? You're going to grow out of it. It's like, would you please read a book? Like,
Okay, a
but
pamphlet.
anything. But the reality of it is, I know that they're family. I know the suffering we have and all of the resources that we have available to us based on our status in the middle class community.
Sure.
I can't imagine. And I know what it's like to also grow up poor, because I was at Cook County until I was 21, until I got a job and had insurance.
Thank
So
you,
I
Fountains
could
Clinic.
not imagine having to take my child to, sit at the county hospital for 2 days and waiting to be seen. Like, that
And
is
we
a
know
whole
that that's
nother,
a lot of
but that's a
people's
reality.
real
That's
life.
real life.
Right.
I know people. That's real life, and we need to, and that's why the education is more important, and that's why the work that CTU and Nina Hike, thank you, and everybody rallying behind this important issue, it's important because this is real life, and many of our students in CPS who are suffering don't have the resources, don't have the health care, don't have the insurance. They need the support.
And don't have the advocacy.
No advocacy.
Right.
And everybody just wants to be hands off, like it's too much. Like, people may frown and grimace a little bit and cry, but they go on about their life, right? But these people have to stay. You have to, take it over, Ms. Hayes, because you know the struggle. But like, the reality of it is, I can't get up and leave.
Sure. I wanted to say to you, because you're around the state, how does this look different in different parts of the state?
Honestly, it looks the same throughout the entire state. It's, again, a lot of people they aren't informed about it. They don't know. First of all, they don't even know what sickle cell disease is. That's number one. And they don't understand the urgency or the need for blood donations and the need for more blood transfusions for sickle cell patients. And like you said, TaLana, it's a temporary solution. It's a start, but there's so many people just throughout the state of Illinois alone who they don't know. They don't know what they don't know.
Can I add?
Please, please.
So at the Sickle Cell Disease Association of Illinois, those are the things that we deal with. So the funding that we receive, then we're in turn able to assist parents that lose their job and can't pay their bills because they're in the hospital caring for their child, or vice versa, an adult with sickle cell disease, they can't go to work because they're in the hospital. Or they need help paying their rent. They need help with transportation to get to their doctor's appointments. They need help paying their electric bill. And then some families, unfortunately, when individuals with sickle cell disease pass away, a lot of them don't have life insurance. So now they need assistance with bereavement. So all of the scenarios that you were mentioning is true, and it is happening to this day. And everybody doesn't have access to hematology centers that even have a sickle cell team. So there are not sickle cell teams at every hospital, and everybody can't travel to a sickle cell clinic. Some people have to go to their local hospital, and your local hospital doesn't have hematologists on staff. They don't have folks that understand that an adult living with sickle cell disease, they've been dealing with this disease their entire life. So at the age of 20 years old, and my daughter can present herself to a hospital and say, I'm in a pain crisis, and she'll know how much pain medicine she gets when she's having a pain crisis. But if you approach a hospital that is not educated in how to take care of someone with sickle cell disease in that way, then now they're looking at you as a person of color that is drug seeking. Because now you're coming into my hospital.
Shows itself again.
Yeah. So I'm telling you, I have sickle cell disease. I'm telling you, I get pain meds and I need fluids. But if I'm telling you, oh, I get 4 milligrams of Dilaudid, your hospital protocol may say, oh, well, no, we're only going to start you at 1 gram. But it's like, I may as well go home because that's not going to help me. I've tried to manage my pain at home and it's out of control. That's why I'm here.
How does it look differently? Or how does the disease look different at 20 than it looks at 10 or 12? You said, your family members are saying, when are you going to grow out of this? Or is he going to grow out of it? And then she's on this end saying, my daughter is 20 and can present at the hospital and they thinking she's there for some drugs.
Yeah.
Right. So does it look different? Does it present different?
Absolutely.
How?
And one of the reasons is because for so long, the life expectancy for sickle cell disease was you aren't supposed to live past, I don't know, what was the book saying? Maybe, I don't know, 20, something like that. 20 or 30 years old. So we have adults that are in their 50s and 60s with sickle cell that vividly would say they would hear the doctors telling their parents when they were younger, you know, that you're not going to live past the age of 20. So now they get to the age of 20 and they living reckless because they're thinking, I don't know if I'm going to survive or not. But that also means that there weren't adult hematologists prepared to take care of individuals with sickle cell disease. So we have a ton of pediatric hematologists, but not a lot of adult hematologists. So when it's time to transition your care into an adult place, a lot of areas throughout Illinois that don't exist. It's in the Chicagoland area. So everybody can't come up to Chicago to get care for sickle cell disease. So that means they're now in all these emergency rooms that are not prepared for them. They're being mistreated. They're being labeled drug seekers. They're being blocked from they're going emergency room to emergency room. It's not because they're looking for drugs. They just want to be treated. Because ever since they were a baby in pediatrics, they would get pain meds and they would get blood transfusions and they would get fluids with no questions asked, because a kid, you taking them at face value, you have parents there with them that are advocating for them. But now that if you have this adult presenting themselves, you're not being viewed the same way. And you're a person of color and they don't believe that we're in pain anyway.
And we're never going to get past that person of color and how that just changes how we're treated, period. But I want to talk about the advocacy, right? What it is, what it isn't, the lack thereof, and then how can we, and all of you, please do share and chime in on this. What information can we provide to parents, whether they're in our school communities or our communities, or if they show up, what information can we give them, or what information can be provided so they then can advocate for themselves and advocate for their child?
I think I would probably defer this question to TaLana or maybe Mr. Burgess, because we're working in partnership with organizations like CTU to educate, inspire, to bring more people out to consider donating blood. And if not donation, then, you know, spreading the word, getting the information out to other people. But the advocacy, honestly, with the Sickle Cell Disease Association of Illinois, I mean, she is a huge advocate. And I love TaLana so much because she, I mean, not only because of her experience personally, but professionally, I mean, just, it's amazing to listen to her and to listen to the information. Like, I learned something new here today. So I'm listening to everyone on this stage today. And it's like, it's always something else that you may not have known, because again, we don't know everything that there is to know about this disease.
Sure. Well, TaLana, can you talk about that? How can we get parents to what kind of conversation should we be having? Like, what kind of conversation should educators be having with parents? Right?
Yeah.
In the beginning of the school year, we're just giving them so much information. Should this be a conversation that we're having about, like, knowing where your child's health status is?
Yeah.
And then how do we teach them how to advocate for themselves?
So 2 things, 504 accommodations and IEP. So a lot of our families don't even know that their children can have accommodations based on the diagnosis of sickle cell disease. So one of the things that we always have to explain to them is you can, like, that puts them on a level playing field. But the issue is that the child that's in the school, you can't look at somebody and say, oh, you have sickle cell disease. So they look normal. They look like nothing's wrong with them. So the administration or the educators are just looking at you like, okay, you have sickle cell disease. What does that mean? How does that manifest? And how can we help you in a school setting? So as a parent, is having those meetings with the staff, with the teachers, prior to the school year starting, getting accommodations put in place, such as being able to go to the bathroom. Why? Because if I'm at risk for being dehydrated first. So a person with sickle cell disease needs to drink a lot more water than even an average person, which is going to make you have to go to the bathroom. So if the teacher has a rule that you can't go to the bathroom, that's already a problem. Another thing was in some schools where it was like, oh, well, you can't wear coats, or you can't have this extra clothing on. Individuals with sickle cell disease, because of the anemia, may be colder. So they may need to wear coats. They may need extra time to get to class. They are extremely fatigued. They may need to go to the nurse and get pain medication. They can't take pain medication and still be in the school setting. They hospitalized sometimes. So when Mr. Burgess was talking about absences, one of the accommodations that my daughter had in high school was they don't apply to her. So when we go to call, when I come to call the school and I'm calling her, now I did have to still call every day, but the reason is 504. And that's what I would say. And that was just what we had in place. But it was because they had a where if you're absent however many days in a row, but if she's in the hospital for a week, that doesn't mean that as soon as she gets discharged, she's going to be right back in school the day after she's discharged. Because honestly, once you're discharged, she may still be at home for about 3 days, still trying to get herself together. But it's like the small things, then she get extra time to take tests. She gets the ability to be able to make up work. Or what I learned and didn't even think, well, we'll just take out some of this busy work. But a lot of kids get put out of school because the parents didn't tell the school that they have sickle cell disease. They didn't know that they can have accommodations, but now they're getting kicked out of school because they're behind or they're failing. And it's really because they just were never had the ability to be put on a level playing field. So with, I see this as an opportunity and a partnership because we have a ton of materials and we have an office and we have other parents and we call in. I've participated in 504 meetings with other parents that just aren't comfortable. Everybody isn't comfortable being an advocate.
Sure.
So we have other parents and other families and we have a huge support system of other families and we really just try to share stories and work together. We have templates for accommodations that work and it depends what school setting you're in. Sickle cell disease is extremely complicated and we have about, I don't know, 4,000 to 5,000 individuals in Illinois that are affected by sickle cell disease. And that's just approximate because we truly don't know the real number.
Right, because you were saying they don't change the numbers.
Right.
Right. The research doesn't allow for them to do the data to crunch numbers.
Can I
Doctor,
just piggyback on your comments, TaLana? I think there's an opportunity for the medical teams to be able to engage with the teachers and the schools on educating them as well about sickle cell disease. I think we're lucky in that probably the hardest person working on our team is our social worker, and the second hardest working person is our education liaison. It doesn't mean that we could always find the right resources for our kids who are having issues at school, but it gets really, really complicated. And I would say that, sometimes there's a balance between our kids who have sickle cell wanting to make sure that they have the right accommodations, but don't want to stand out like they're being treated differently. And it can be really complicated when the parents and the doctors and the teachers are working towards what they think is in the best interest of the child, but we as a medical team don't necessarily talk to the child to ask them what they need and how they want to handle the situation. Mm-hmm. So I guess all that is to say that we definitely have opportunities to work with teachers to educate them about sickle cell. What does it mean to have a 504 plan? What are the, what does the IEP look like to best serve the child? Because just like TaLana says, these children are hospitalized. They go home, the doctors taking care of them in the hospital think they will go right back to school, but it can be, the impact extends beyond the discharge period, and it may be 3 or 4 days that the child is still out of school, the parent's still at home, not at work, and so the last thing I was going to say is that there might be opportunities for us to think about educating the kids in the classroom as well, and that might be an individual decision
class.
And have a conversation with the child. I have college students with sickle cell disease who I have a hard time convincing to have them tell their roommates that they have sickle cell.
Wow.
And I'm like, you need to. If
is it
something were to
why
happen
though?
to you,
Is there a shame?
It's a combination, and I think it's different for every child and every adolescent or young adult. And I always want to respect their privacy and their autonomy in making those decisions on how they want to share the information. But it's about us as a team, as a team with the parents, to be able to destigmatize the sickle cell disease and say, hey, lots of people have chronic medical conditions. You can do and achieve what you want to do. Let us help you do that. And you should see yourself as having this role of educating others about it. So we have other kids who tell their friends about their sickle cell disease and why they are always missing school to come to clinic to spend 3 hours in clinic with us, and so on and so forth. But I think there's a real opportunity for educators to say, hey, how do we team with a child's classroom to make it a learning opportunity to say, let's learn about sickle cell disease. And
to
maybe
make it
a little bit
safe.
tricky, I understand that, but you know, for some kids, it might be a really great thing.
And to your point, Dr. Liem, the science department at Westinghouse has done a great job of.
Plug,
No, I mean,
plug.
And we're gonna
I'm
call
plugging.
Miss Nina
I
Hike
mean,
up to
if-
talk about
if,
that
if,
a
if,
little
you
bit
know,
of that work.
if high schools in the city want to see how science departments are really doing an effective job at that, like, I mean, the doors at 3223 are open, but I mean, our biology team, has been educating about, different cell disorders and blood disorders for quite some time. And then we just elevated it even this year with the chemistry team taking it on to to look at this aspect of giving blood and what that means, and all of the work from expertise. I think that when you take and just, I'm a former math teacher, right? So I'm always just looking at data, right? When you think about it, almost 10% of like the Black population, right? 1 out of every 11 Black babies are born with the trait. That's a lot of folk. That's not like 10% of something that's not something to close our eyes at,
Sure.
right? 1 out of every 500 babies born with the actual disease. That's not something to say this doesn't impact us and let's go to sleep. Let's really have some real conversation, and schools need to be educated. And I think sometimes our those battling the disease, they don't want to be outed, right? Because everybody else is just having this normal experience. And sometimes silly teenagers are like, their kids are going around the school. Oh, Michael, my son's name is Michael. Oh, my finger hurts. And we're like, get the hell out of here. Like, this is not a hangnail issue. Like this, you don't even want to understand this level of pain and the complexity of pain.
Sure.
And so I think so we start with educating, like we start with giving data. We start with showing that you can have real conversations that can be real life, lessons in schools to help educate and equip people with the tools.
And what did the conversations sound like when you had to have them, both as an administrator in the building and as a parent that had to advocate for your child with his classroom teachers around this? Because you mentioned a situation that happened with your son last week, and he wasn't feeling well. And so what does that conversation need to sound like?
So don't get me in trouble because you all are taping this. But so I mean, the incident that happened with my child last week, he was in pain and wanted to leave class. So he left the class, and the teacher was kind enough to send him with a student because that's CPS protocol. So teacher follows CPS protocol. But anyway, my child left the class and he didn't make it down the hall before he collapsed to the ground. And the poor kid that he was with just didn't know what the heck to do. And so at this point, one of my colleagues is texting me. I don't even recognize the number. So I'm really freaking out. Like, who's texting me on the job? I'm meeting with a parent. I literally left a parent. I'm like, my own child is in crisis. I'll be back to talk to you about your child in a minute. And I just, left my office, ran. But at that point, like it was evident that we need to communicate that we don't send them out, even with another student, that you call for the nurse to come because it can be critical too fast. Like there's no warning. Like there's no, oh, you can make it down. Like you're good. You can walk down. No, you could try to make that walk. And if you're making it alone or you're making it with another student, it could really escalate and become a medical episode that we all, like, we don't want it to become unfortunate, right? And so, like, that's why we have enough adults in our building so that we can, like, help students when they're in need. Like, you just send a nurse.
That's a powerful testimony you just said. We have enough educators in our building. You said two things and my whole head was about to explode. You said the nurse, call the nurse.
Call
you said we had enough educators.
We got enough people in the building.
Somebody is getting this right. I'm just saying. So
somebody's getting it right. Thank you.
Westinghouse is evidence. Right. Look. Westinghouse is evidence that it can be done right.
It can be done.
That's all
right.
I'm saying.
But on the educational part of things, like, we having real conversation. Nina Hike, who's exemplary science teacher, she's always trying to hide in the background, but she's really the reason that we're having this blood drive here today, and that we're going to have it at Westinghouse on Monday. So, but 26, she's been here a long time teaching in CPS, but we're just having a conversation in the hall with her, really just checking in with me. That my teachers see me every day, and a few of them check in with me for real. They see the days that I'm like exhausted and I look like if you just push me, I'm going to fall over. And so we are just talking, right? We're having a conversation. And I just brought up the fact from Dr. Liem's team that how critical blood transfusions are and how critical receiving blood from Black donors is even more critical, right?
Say why.
And the reason why, I'm gonna let the doctor say why, because I am not a scientist. Dr. Liem, just say why real quick so they can hear.
Yeah, it's not a short answer, but you know, when you receive blood, you know, the most important thing is that we have to match by your blood type. That will reduce the chance of a very, very significant reaction. That being said, there are other proteins that are more minor proteins on the surface of your red blood cells that if you have differences in those protein profiles and you receive blood from somebody who has those minor differences against your own, your immune system might recognize that and react in a way that next time makes it more difficult for you to receive blood and increases your risk for different transfusion reactions. So the risk of having those differences in the protein profiles will be lowered if the blood that you're receiving is as close to your race or ethnicity as possible because of how those proteins are inherited genetically. So we do something where, you know what, we try to reduce that risk right now by trying to do what we call extended typing beyond regular blood type to make sure that our sickle cell patients receive blood that's closer in those protein profiles. But we don't have to, the chances even is lowered even more if the blood that our patients are receiving are from individuals who are of African descent or who are Black. So we receive our patients on a monthly basis go through about 100 units of blood. So as you can imagine, I mean, the numbers required to treat our patients are very, very high. And if we can get to a point where we have enough or have a large proportion of those units from Black donors, I think that really could significantly reduce the risk of some of these complications.
Thank
So
you
a short way of
Sorry,
saying
so
that
that
was
was
a
a
short
Black
answer.
blood matters. Let's just put it out
Black
there like
blood
that.
matters.
Black blood matters.
At that, I want us to just pause like right there, and I want Miss Nina Hike to join us for a moment. This incredible educator, incredible humanitarian, incredible scientist. And while she's coming to the stage, I want to just foreground something. Nina brought this up. We were in Human Rights Committee, and I knew this was coming up, and I wanted to get as many partners involved in it because I understood how important it was. But it was such a passion project for her as well. So I want to talk about two aspects of it. I want to talk about us just amplifying and uplifting the Dr. Charles Drew, right? And I also want to talk about who we are honoring, one of the fallen who died as a result of a sickle cell crisis.
Yeah, so basically, we've been working with the HRL framework. And so as a trained biologist and chemist, I was just like, I always talk and exemplify, white male scientists. And so I'm trying to divorce them right now. And so I was digging through trying to find like a Black scientist or a person of color that did like research on density, because every chemistry teacher teaches about density in the beginning of the school year. And so I'm like, it's got to be somebody out there. So I just been digging and digging. And then finally I found some information on Charles Drew and the fact that he used density to separate the blood into plasma, toward the plasma part. And you can use plasma and you don't have to type it. And it helped heal the World War II people that were in Europe fighting in the war. So they actually shipped the blood to Europe to help them, the plasma, and they could keep, and the blood was, available for the soldiers. And so then Charles Drew came back and started in the US with the Red Cross. And so since I'm also teaching about racism too, so I also talked about the fact that Charles Drew, even though he discovered that and kind of helped start the blood banks, he couldn't donate himself because he was Black. And in the US, they were segregating the blood. And so then eventually, you know, of course, Black people could donate blood. And so I'm telling my students about this, and I'm also teaching them about density too at the same time. And so now we're even going to go even further next year. Mr. Burgess doesn't know this, but we're going to go even further, because if we start looking at like ways to do the blood and separate it with lower, you know, with more less expensive equipment like microfluid technology, then that'll even help make it even more affordable and accessible more places, because right now they use these big giant centrifuges and things of that nature to separate the blood. And so now the students at Westinghouse, hopefully next year, will be kind of experimenting with microfluid operations to see like how they can use density to separate, not blood, but like they have these micro beads that kind of simulate blood and the density and stuff. And so I'm just excited about extending some work of a Black scientist, not just doing Black History Month. Like this is a part of our unit. Like we're doing this, we're investigating it, we're looking at the different variables. And so we're not just doing it during Black History Month. Actually, the unit's been over, but I just wanted to make sure that once I heard the conversation, that those kind of conversations, when you elevate Black scientists, and you're talking to a Black principal, and then their son is suffering from something, and you know it, and we didn't know that this conversation was going to happen, but when you do start elevating Black scientists and their role in this history that we have here in America, then you can make those connections. And so all of the Westinghouse students that take chemistry, that's everybody, right? That they're going to start this new generation of students that know about sickle cell, because in biology they teach about sickle cell, and then when they come to chemistry the next year, they're going to also learn about Charles Drew, and then we're also going to be looking at the blood and trying to find a more fancier way, a low-cost way to separate the blood using density. So
I don't know if your all's head wasn't just exploding as she was talking, but like all my teacher cylinders were on fire. As she was talking, because all I'm thinking is, whoa, that's cross-curricular, that's scaffolding, that's pedagogy, that's Black women in STEM, like everything
But I
was
just want to
happening,
speak to that.
but that's sound instruction.
Right. But since we're at CTU, right, I wanted to speak to that. And those conversations started a couple years ago when we're like, how do we engage, particularly our Black students in science, right? Like, how do we help them see their identities come alive in what they're learning in the classroom? And I think it's critically important for all of your student identities to surface in what you're doing. And this is an easy way, in a tangible way. And now we have people in the school, we have students that are now forming support groups because there are 4 students at the school suffering from the disease. And so it only just takes one person to have a vision to make something happen. And I'm just honored that we're all on stage together and we're learning together. Like, I know the excellence that's on this panel, and because I know these individuals directly, like we work together, Dr. Liem and his team, they care for my son for real, and I am blessed that they care. Like, Lurie's children is like the top of the top. The experience that they're having, there are only 2 to 3 hospitals in the city that are having that type of experience. One time I got frustrated with the hospital and tried to take my son somewhere else, right? And that, good luck with that. You're right. And this is exactly what happened. When we turned on the TV, he was admitted, and we turned on the TV and he rolled over. He said, "Dad, where are the kid channels?" And I was like, "They don't have kid channels in this hospital." It was time to go. I literally checked him out of the hospital. It was I had a John Q moment, and I was like, "You're gonna discharge us now."
One of Denzel's best films.
Yes, yes. I was like, I'm gonna go back home where I belong, and I'm just gonna ask my church to continue to help paying for my parking, so that I can make this happen. But like, I am blessed to be in that space, right? I'm blessed that my child has some of the best doctors. He goes to a wonderful school. But when your children are suffering and they don't have the best doctors and they're not getting the best education, just that whole thing, it just makes my heart break, because I know not every child dealing with this disease is having the same experience.
Sure. Back to your point, just real quickly, the point you said, how do we engage young Black people in science? and it's one phrase, it's relevant curriculum, right?
Absolutely.
You've built community around it. You've built it into two of the science disciplines. You have lived experiences. You have advocates, right? And that's how we engage our young people with these things that for some odd and most mysterious reason, people think it's just elusive, like they can't grasp it. And yet, Charles Drew, we have Charles Drew, we have Percy Julian, we have all these amazing examples of Black men in science and Black women in science. And so I'm so happy to know just what you are building at Westinghouse. Our young people deserve that kind of instruction. They deserve that kind of high expectation, rich instruction that's culturally relevant to what's happening with them. Nina, while you're still with us on stage, could you talk a little bit also about who's being honored?
Oh, so Lloyd Newman, I read about Lloyd Newman. He did Story Corps. He kind of started Story Corps, where he was in, I believe, Cabrini Greens, if I'm not mistaken. Ida B. Wells. Okay, Ida B. Wells. Sorry about that. And Ida B. Wells, and they wanted to kind of tell their story, him and one of his friends, when he was about 13 or 14 years old. And they basically created their own kind of news story about living in Ida B. Wells. And so I think that that was just fascinating to kind of read about that, but then also find out that he also suffered from sickle cell anemia and had recently passed away from sickle cell anemia at about 40 years old. And so that's why today, not only are we kind of honoring Charles Drew, Dr. Charles Drew, we're also honoring Lloyd Newman for his work and even starting, Story Corps and kind of telling about our lived experience, because I'm actually from the Allgare Gardens. So I grew up in a housing project too. And so it's like, we all have our stories to tell. And I just feel like if we did talk about those things in school, like that, and kind of elevate his, why aren't they talking about Story Corps in English? I don't know. But it's like, if we start elevating those stories about, how we tell our stories and what we know and how Black people have that oral history that they share, I think that that's another way that we can kind of pass the word around about sickle cell anemia and get it out from being this hidden thing, that people don't know about until you go to the doctor and you're pregnant and they ask you if you have sickle cell trait. And then you're like, oh, who has sickle cell trait? What's that? So, I think that we can keep building this conversation around that. So.
Thank you. Thank you so much. Thank you. And thank each and every one of you. I just want to go around before we wrap up today and say if there's just one last thing that you would like to share with our audience about what we've discussed today, just one final thought.
I think you brought up, because I think, I don't know, it's so many things that I can kind of talk about, but the way that I found out I had sickle cell trait, I was pregnant. So most of the time, most women find out when they're pregnant is because that's one of the tests that you get. I don't know why we don't get that test earlier than you're pregnant, because it doesn't give you the opportunity to be proactive. You then have to be reactive. So because I tested positive, then they had my husband come in and tested him. And I'm like, what? I didn't even know I had sickle cell trait. And then he also had sickle cell trait. And so when I had my daughter, those was one of the things that I knew when I first started working at the organization. And the way that I found out that my daughter had sickle cell disease was like over the phone, and oh, well, you need to find a hematologist for her to go to. And it was just like, I was clueless and lost. And I said, I don't ever want a family to have to go through that. And at the same time you're receiving a diagnosis, you also should be connected to a community of support or to a community-based organization.
Thank you.
Yeah, I was just going to say, we just have so many more opportunities still to advance the care of individuals who have sickle cell disease. But I constantly try to remind our team that one of the most important things that we can do, even though we are considered a medical team, is to educate. And that's to educate our families, our patients, the people who take care of our patients, other providers. It's just an important inherent part of this job. And that, what I love about taking care of families and patients with sickle cell disease is that I always bring advocacy to the table every day. And that was really important to me when I went to medical school.
Thank you so much, Doctor.
I just want to say how important the work that we do as educators. My path to Lurie's actually came as a result of a partnership that Westinghouse has with Northwestern Medicine. And so we've partnered with Northwestern Medicine, and each year 6 of our freshmen are selected and are partnered with world-renowned physicians at Northwestern and Lurie's, and they are mentored in both medicine and science. And I just happened to be at an event, and one of Dr. Liem's former colleague was an amazing Black woman, who is an amazing Black woman, but they took her to the other side of the country. But Dr. Alexis Thompson happened to be on the board, and she gave a presentation. And it was that day I was like, my child can receive better care starting today. And I moved Michael to Lurie's. And so, like, I just say that to us, what we do at our schools matter, because it was the work at the school that brought me even to Lurie's Children's Hospital. And I am grateful for that. And so I just want to remind us, like, this is not above us. The work as educators, like, we are finding the resources for families all the time. And we have to continue to stay in advocacy mode, because we are the biggest advocates for our students.
I would say conversations like these are really critical. More conversations like these. In particular with the American Red Cross partnering with educators, educational institutions. That is one of our biggest initiatives. So we work with many high schools and even grade schools across the city and the state of Illinois. Also, we work with a lot of organizations, Black organizations, to hold blood drives, to get more educated, more information out. What we also want to tell people is that through the end of June, if a person who is a donor self-identifies as an African American, they will be tested for the sickle cell trait, and they'll be notified.
Wow.
So, but yes, conversations like these are priceless, and I think we just need to have more of them.
Absolutely.
Can
Absolutely.
I have a final word?
You sure may have a final word, Ms.
Okay,
Nina.
so my final word would be to encourage all chemistry teachers in Chicago Public Schools to look up Charles Drew. You could go right to the American Chemical Society. If you email me, I'll send it to you. But they have all the information that you can use to teach about what Charles Drew did for the blood drive. So thank you.
You are so welcome. You are so welcome. And thank you. Thank you all for being such a great audience. Thank you for this opportunity. Thank you to the American Red Cross. I'm so grateful because, we did a lot of publicity. I was making lives. I was talking about, save a Black life, donate blood. And what I'm so happy to see, it got a little chatty, but it was good chatty, because it was just a constant stream of people coming in, getting tested, and donating blood. So I want to say this was a very, very successful event. And so thank you so much, Carmen, for hosting it yet again. Thank you for always being open to the next big thing. Thank you to our leader, Ms. Stacey Davis Gates, for always being open to connecting the dots and extending our community, enlarging our territory, and growing our community. And finally, thank the educators and advocates and doctors on this stage. Yeah, Carmen.
I don't think they want me to talk no more here. I want to say thank you to everyone on the stage. I want to thank you for coming to the Chicago Teachers Union and sharing your vulnerability. I don't even understand your resilience. Have no clue. Thank you for sharing. What you've given us today is an opportunity to rethink practice. And if you don't know, our union believes in learning things so we can memorialize and codify within our contract. What you just said is that you had a nurse. That's why every school will have a nurse by 2024, is because that we deserve that, right? We struck for that. So when people pop off about CTU, they don't understand the backstory and why it's so important. And that's why we have to do things like that so people understand. You talked about a 504 plan. A 504 plan comes with an IEP meeting, but it comes when you have special education staff that can provide that and implement and then enforce it. You understand what I'm saying? So when special education is defunded, right, by the district, and when people look the other way and think that they can do, they can give you some services or some money 5 years later, that's unacceptable. So please understand that it is our voice and advocacy that is informed by the lives and the experiences that you all shared here today. I appreciate your vulnerability, your expertise, and your time. I can't wait to figure out how we partner and continue to partner and make this an annual event. So thank you so much.
I have a quick comment. Don't move so we can take a quick picture. But in our last conversation, there was something that was very interesting that was said, is that as donors, you can decide where you want the blood donated to. So someone here, does everybody remember that conversation? Right, that, can you speak to that real quick so people understand that?
But I don't know. Can you still do that? Right.
Wherever there's a need for blood is where the blood is going to go. Okay. You can track where your blood goes. You can't not necessarily designate where you would like your blood to go.
Yeah, one of my colleagues, Dr. Mack, who I want to make sure gets involved in this next year because he's in charge of our blood donor program for the sickle cell program at Lurie Children's, and he's been working with the ARC in having specific.
He's on the board.
Yeah, he is on the board, and he has helped to host blood drives specifically where there can be what's called the blue tag program, where you can request a blue tag so that gets assigned to a unit of blood that we hope will be used for a patient with sickle cell disease. The logistics sometimes make it so that it's not guaranteed, but we try very, very hard to have some of those blue tagged units come to our hospital, and so it's a really great program when it works.